You're watching Fighting Dirty with Hank Balch.
Hey, Sterile Processing Universe, it's Hank Balch here, and you're watching and listening to Fighting Dirty. And on this episode, I want to talk about surgical site infections. Now, which one of you have ever had a conversation with a surgeon that goes like this? My infection rates are low, so I don't have a problem with my flash rates or my IUSS rates. I don't have an issue with my bender trays coming in late. I don't have a problem with not enough inventory because we find a way to turn over my items quickly enough and everything's hunky dory. Or perhaps your administrators are the ones who have a conversation like this. We have great numbers. Our surgical site infections are very low. So SPD must not need a cart washer. You must not need another instrument washer. You don't need any more people because all the data says that everything is fine. Well, friends, I have one talking point for you to help you in this conversation, and it's this. Ask a question. Are we using antibiotics on these patients? Simple as that. Are we using antibiotics on these patients? If so, please explain to me how you know that our process is not introducing additional pathogens into these patients because, in fact, sir, ma'am, we do not know. We are acting and assuming as if we are introducing pathogens because we are using antibiotics to kill anything that may be introduced into the patient. Now, granted, it's not just for the sterile processing side of things. You're opening a patient in a room and there's all kinds of potential contaminants, even outside of the surgical instrument question. But the question remains, why can we trust statistics such as surgical site infection rates if we are introducing something like antibiotics whose very purpose is to kill any potential microorganisms and disease causing agents? So, doctor, if you are comfortable enough with the delivery time of your loaner trays, if you're comfortable enough with your IUSS rate, if you're comfortable enough with your limited inventory that we constantly have to turn over again and again and again to support all of your volume on one day that would be safer to spread out over 2 days, sir, if you think this process is safe enough, I challenge you to stop using antibiotics on your patients, and then let's really see. Now, I know many of you won't have the opportunity to have a conversation as open and poignant as that, but that is the current state of things. We're all aware of the challenges of multi drug resistant organisms, the overuse of antibiotics, and friends, this conversation right here is one of the challenges behind those that has not gotten enough press. But at the end of the day, we don't really know how safe our processes are. We know that if it's bad enough, it will reflect on the surgical site infection rates. We know that it's so bad that even the antibiotics that we're using can't stop it. Yeah, that's bad. But we have no idea actually how good our processes are. So do not let a physician, administrator, anyone at your facility pressure you and reject your request for staffing, for equipment, for resources, for instrumentation, for policy changes that you know is in the best interest of the patient just because your surgical site infection rates are low. If you're using antibiotics, you pull out that trump card and say, let's have a serious conversation about this data and let's be real. We need the tools to do our job correctly, and your data is not the full picture. If you have this conversation with your administrators and physicians and it goes well or it doesn't go well, I want to know. Send me an email at hank@beyondclean.net and let's keep this antibiotic question going. This is something that our industry needs to talk more about. I hope this video is encouraging for you, and I look forward to talking to you again next week. Until then, keep fighting dirty I'm Hank Balch.
Why aren't your customers reading your blog posts? Why isn't your company's one post a week getting all the reach, engagement, and buzz that you expected? You have great content. It's creative, consumable, and offers value to your audience. You should be making a social media splash, but then it doesn't happen and you are left wondering why. Your struggle may have nothing to do with the content, and it could have everything to do with your content flow. Some companies subscribe to the idea of a content drip, posting something every now and then, to remind people that you exist. But that's not enough. Once or twice a month, possibly even weekly, every day folks are hit by a social media waterfall when they log into their accounts. Your company is competing for eyeballs, and what are the chances they'll scroll down far enough to see that one post a month? What's the likelihood your new graphic even crosses their newsfeed? You have an uphill battle to fight, and if you want to win, your content can't drip. Beyond Clean can help, offering an array of social media consulting services. Contact us today to start your free 45-day trial.